my family, diabetes runs rampant in my family. And um, my family consumes large amounts of seed oils, stuff in a box, stuff in a bag. And I personally try to keep that stuff out of my house just because I know that it's not good for you and I know it doesn't make you feel good. But diabetes is definitely a factor in my family and across many other families. And I've seen some folks on social media talking about how diabetes can be reversed. Is that possible?
Yes. So type 2 diabetes, we're talking about specifically. And yes, it certainly can be reversed. And, I myself, in the patients I work with, have seen it many times. The other practitioners that I talk with in the metabolic health space, same thing. We actually have a good amount of published data. The largest probably series looking at this comes from Ovadia Health, which is a organization that focuses on reversing type 2 diabetes with diet and lifestyle interventions. And they have shown their program to be quite successful. Over 60% of their participants at 2 years have reversed their diabetes, meaning that they have normal blood sugar levels off of medications. So it is possible. And everyone with type 2 diabetes needs to get that message. Because again, it's not the common messaging that we have in healthcare. The common thinking about type 2 diabetes is it can only be managed with medications and that it's a progressive disease. It's going to get worse over time. But we now have very good evidence showing that it can be reversed. Diet and lifestyle interventions are the way to do that. And, if you have type 2 diabetes, if anyone in your family has type 2 diabetes, that is an important message. And then you need to seek out the help from the, healthcare professionals that can help you to do that.
All right. So help me out, doctor. I'm ignorant. Is type 1 the worst or is type 2 the worst?
So, it turns out that there are basically two different diseases that end up at the same place. So diabetes is viewed as having high blood glucose. That's sort of the end result of it. Type 1 diabetics don't make insulin. So insulin is the hormone that our body uses to control our blood sugar levels. And type 1 diabetics don't make insulin. Usually comes on during, childhood, although it can come on later in life. Type 2 diabetics make a lot of insulin that their body isn't responding to. They become what's called insulin resistant. So their body is making lots and lots of insulin, but their cells aren't responding to it. And this is one of the end products of poor metabolic health. And so they end up with a high blood glucose level as well. So both of the types of diabetes end up with high blood glucose level, but they actually come from exactly opposite problems. And, that becomes interesting because one of the ways that we oftentimes treat type 2 diabetes is by giving insulin, even though there's already an excess of insulin, which is a little, doesn't quite make logical sense. But that's what we do in the healthcare system. And instead, for both forms of diabetes, but especially for type 2 diabetes, if you just stop consuming so much carbohydrate, you stop putting so much sugar into the system, you can control and potentially reverse it. Type 1 diabetes is not reversible because the body just doesn't make insulin. You can control it a lot better still with low carbohydrate diets. And many people with type 1 diabetes have great success with low carbohydrate diets, but it's really not reversible because we haven't found any way to get the body to, start making insulin.
Interesting. Okay. I appreciate that clarification. Does diabetes, in fact, is it a family gene that gets passed on from generation to generation, or or is that a misconception?
Yeah, there may be a genetic predisposition to it, but it's not truly a genetic disease. And it turns out the reason that diabetes seems to, run in families and we think it's genetic is because families tend to have the same habits. They tend to eat the same foods, and those habits get passed on generation to generation. So it's not truly a genetic disease. There are some, genetic influences, is the way I usually explain it to people, that might make you more prone to diabetes, more likely to develop type 2 diabetes. But it's not truly genetic. And therefore, no one is destined to get type 2 diabetes. I think everyone has the power, again, to, make these diet and lifestyle changes and prevent themselves from getting diabetes if they seem to be at higher risk for it, or, start to reverse it and improve it.